Hello, welcome to the I Belong Here dental workshop. We're really excited about meeting this evening. We have three amazing speakers that will be covering, oral hygiene and why it's important to have the understanding or the education in this area because many of us, we deal with our teeth every day, don't we? And if you don't have the teeth that you were born with, or that came in, as a child, you have dentures that you need to care for too. So either way, we're caring for our oral health. And it doesn't just, involve teeth, I'm sure. We're talking about our gums, we're talking about just our mouth in general. So this evening, I'm excited to learn more about the things that I probably was never taught, even at age 37. I'm sure there's still a lot to learn. And it involves our bodies. So this is definitely something that I'm excited about, and I'm sure you all are too, and that's why you're here. So I'm going to briefly introduce three of our speakers and discuss what we can expect today. So we have three speakers, one that I know personally, and her name is Stephanie Charity. The other two speakers are Kari Carter-Cherelus. Did I get it right? I did. Great, great, awesome. And then we have last that's going to speak, that's going to come up, is Dr. Karen Ann Gordon. And let me add her in. Okay, so what we can expect by the end of this workshop is to identify the critical role dental hygienists play as their patient advocates for overall health and wellness. They're going to explain the importance of incorporating adjuncts in our oral health care routine, and for us to figure out a way to determine effective strategies that will help remove barriers to receiving oral health care treatment. Now, many of us, we don't have the privilege of having healthcare, so this information is going to be very useful to you, I'm sure. And then for those that do have insurance, I'm sure you have yet to spend an hour with your dental hygienist where they can educate you about oral hygiene. I am going to now hand it over to the host for this evening so that way she can formally introduce the speakers, including herself. Again, this is I Belong Here, presenting to you the dental workshop. Stephanie Charity, the floor is yours, or the screen is yours, rather.
Thank you so much for a wonderful presentation, Queen. I'm so happy to be here and also happy to have the interest in oral health care. We have my good friend, Kari Carter-Cherelus. She has a very varied, dental career. And not only is she in clinical, but she also does public speaking. So oral health and education is our main focus. We're all visual learners. We've all dealt with anxiety, and it's very important that we feel comfortable and have healthcare providers that look like us, right? Gender and our skin tone.
Right.
So I'm happy to say that I do know Kari personally. The other friend of mine that will be joining us is Dr. Karen Gordon. I have been on her table, so I can relate firsthand that chiropractic services, they're very important and valuable. They do work. So at this point in time, just because we know everybody's evening is brief, we will keep it fun and we'll keep it inviting so that moving forward, you know what to expect of your dental health professionals. You know how to judge who is a good provider for you and what is a good treatment option. And so I will hand the floor over to Kari.
Well, thank you, Stephanie, for that great introduction. As she mentioned, I do have a diverse dental career. So I did start off clinically as a dental assistant, then I became a dental hygienist. And now really I work non-clinically for the most part as a public speaker, a writer, an author, mentor, coach, CPR instructor. Basically, I do it all. And it's because I really love helping people. So I'm either helping our colleagues, I'm either showing representation because I didn't think that I would become all these different things. A speaker. I never had a hygienist when I was younger who looked like me. So I'm able to be that for other people to show that you can be all of these different things. And that's why this presentation is so important, because when we see people who look like us, basically, then it shows us that we can do all of these different things. And then I'm sure all of us have had a special relationship when we have a provider who looks like us, who we can relate to, or feels like they will actually advocate for our needs. And so that's what I try to do for my patients. Even before I came on here, I was rushing to Sephora, and I mentioned I was a hygienist because of my t-shirt. They liked my Black History t-shirt from Target. And then I had to hear about her having an implant and giving someone. So I never turn off. I'm never just a hygienist at one time. And so if anyone wants to contact me, here's my information if they need some different resources. But what we're talking about tonight really is the importance of oral health and how it is a window to our body. And so unfortunately, insurance kind of separates our body in parts. We have vision insurance, maybe, like you said, if it's a privilege, or oral health insurance, dental insurance, or medical insurance, but most of us have none of these things. So this is something that we want to have because that can assist us. It never really covers everything, but it can assist us in the health. And so sometimes when we see patients, they come to the office and they just want a cleaning. They don't want x-rays. They don't want us to take their blood pressure. They just want, we get it. They want to get in and get out because maybe they're on their lunch break or it was a sacrifice of time just to get there. But it's important for us to do all the necessary assessments, just like when you do go to the doctor's office and they may weigh you or take your blood pressure or your pulse to really see what is going on with you, because the same thing is going on with our mouth. There's different assessments we have to do. We have to take x-rays because we are not Superman. We don't have x-ray vision. We can't see what's going on with the teeth without having those x-rays. We have to do a screening called periodontal charting, where we take a little instrument and probe around your gums. We try to make it as comfortable as possible. You can always ask for topical or something to numb you. I give it to my patients. Not every hygienist is as nice as me, but you can ask for it because I don't like pain. I like to be comfortable. Don't want my patients in pain. And then also there's oral cancer screening, which is very important for us to do. So I teach my patients to do their own oral cancer screening as well. So you can just feel around your neck for lymph nodes or bumps. At times, if you are sick or congested, you will feel stuffy, so you don't have to necessarily run to us if you feel that. But if you're feeling something for like 2 weeks or so, you need to get that checked out. And then in your mouth, you're looking for like the flag, red, white, and blue. Now we do have red in our mouth and white. I have bit my cheeks over the years, so you will see like cheek biting, trauma and things. But if you're seeing something that's different, usually on the underside of the tongue and things, then you especially need to go to your dentist. But that's why it's important to see us regularly. Sometimes people go years, and it's really because of those barriers that we have, lack of insurance or fear how much it's going to be. But we see what happens to people we love, like Black Panther, Chadwick Boseman and everyone, when maybe there's a delay in those necessary assessments. So these different oral health conditions that we look out for, they can really cause problems. And so that's why it's important for us to regularly see dental professionals, because what's going on in our oral health can affect the rest of our body. Everything is connected. So cardiovascular disease, I have a 3-year-old, so pregnancy, keeping my mouth healthy was important to keep my baby healthy, because this can contribute to birth complications. Also, if people have different issues already, if they do have diabetes or HIV/AIDS or Alzheimer's, all this is connected, and it can really exacerbate the condition as far as inflammation. And then our mouth tells a story about how healthy you really are. So sometimes we think we are very healthy. We may eat right, we may exercise. We may just feel like, sometimes there's a joke that we're missing a side tooth or something like that. But the main thing is that if your mouth isn't healthy, you really aren't healthy, because that inflammation can cause issues. If you have infection, if you're having a toothache, you don't want to ignore it because it's going to travel. And I get it. My first toothache when I was like 21, I kept putting Ambisol on it. I wasn't in a dental professional just yet. And so that small cavity ended up becoming a root canal, ended up becoming later on a crown. And money I did not have at that time as a young married person when I got married. So treating something when it's small can really help. And like we said, there are different barriers that can contribute to the issues, which I'll talk about in a second. But some common dental problems is bad breath, tooth decay, and gum disease. So at times, the cause of bad breath can be food. We know onions, garlic. I drink green juices sometimes, and that can make my breath kind of smell because of all of that greenery, the chlorophyll in there. It could be poor oral health care. So patients who are not brushing regularly or properly or flossing or don't know how, or some people don't have, you think everyone has those tools and not everyone does. Not everyone has access to that. Some families actually share them. You would think that's shocking, but they actually do. Periodontal disease is a big deal. As a hygienist, we know the smell. We can smell it from a distance. We can diagnose anyone who has it from a distance. However, there's other things like dry mouth. That can happen if you're taking different medications. Depression medication can cause it. High blood pressure there's a long list of different medications that can really affect our mouth. And that's why we ask, what medications are you taking? So people hate to fill out the forms. They're like, why do you need this? Just clean my teeth. And it's because certain procedures we do can affect you, or we can give you different treatment ideas or different medicaments that can help you out. Tobacco products is a big deal. So we all know not to smoke and not to chew snuff and all that stuff. But a lot of people are vaping, which is messing up their teeth and messing up their esophagus and their lungs and everything. So it's not a good alternative to that. And then also making sure that we're taking out denture and oral appliances. So even if we may not have dentures, if we're wearing like Invisalign trays and things, that has to be cleaned properly, or that can cause problems with our teeth, or it can smell. And sometimes people think that you just keep them in forever and they eat with them and everything and cause this issue. Tooth decay is a big one. So we know about cavities. We know that certain foods and drinks can contribute to it. It's not the sugar, it's carbohydrates, which break down to sugar. So all the fun pasta stuff. One big deal is energy drinks. So just about everyone is drinking multiple energy drinks sometimes a day. That's not really my bad habit, but carbonated water is my bad habit in my family. That's our bad habit. And those type of products can lower the pH in your mouth. So if you think to lower the pH, it's more acid in your mouth, and acid can eat away your teeth. So you have to do things to counteract that. You want to lessen that. And then having too much of that bad bacteria can really contribute to issues. And then gum disease is a big deal. So unfortunately, in our community, that tends to be something that can take our teeth from a young age. It can really affect people. And if you have different conditions like lupus or Crohn's disease, if you're having hormonal changes, stress, genetics, all these things can contribute to that. When it comes to tooth decay, that's my little baby right there. But when it comes to tooth decay, unfortunately, a large percentage of Black children have untreated tooth decay, and it's nearly double the rate of white children. What plays a part of that is racism, access to care. Sometimes parents being afraid of their children seeing a dentist. I know that when I was younger, when that bad news came about with that dentist that caused issues and people getting sick, I didn't go to the dentist for a while. We used to always go. So sometimes it's fear, trauma that the parents have experienced. Sometimes it's lack of access to care. Could be poverty, food insecurity. It could be hard for them to get there due to transportation. So there's definitely barriers to getting that care. Lack of insurance, like you mentioned, is a big deal. So not having that insurance, knowing that it's hard enough to pay the rent these days, or food and everything. So it's important to really seek out different alternatives. Sometimes for children, they will have different health clinics or mobile clinics, or I work for Arm & Hammer, but Crest has a caravan that comes around, and they really can do different things, or put sealants to protect the children's teeth, preventative measures. So searching out school programs. So if there's a school in the area, such as a dental hygiene clinic, we need patients to graduate. So if you can go to a dental school or a dental hygiene school, usually the services are very low cost, and you can get what you need. Sometimes there's free clinics. There's migrant clinics. There's a lot of different access. It's just that at times we don't have that information. So we have to advocate for ourselves in our community to seek out that information to really close those barriers. One of the biggest in the African American community is fear. So because of all the things that we know have been done to our people throughout generations, there's a big fear of trusting healthcare providers. And so that's why, especially when I see people who look like me, who I know are fearful, and sometimes they work in the medical profession themselves, it's really disabling that fear factor in working with them and being more patient. There's other things that we can help one another with that. So I had a procedure yesterday. I had to go to the OBGYN and had to have a biopsy, and I've had stuff, I was afraid because I've had stuff before. So I requested Valium. So I never had it before, but I said, no, I need Valium. So you can request certain things from your provider. You can request nitrous. You may have to pay for that. There's sedation dentistry. Of course, that's going to cost more, but there's different things that you can request so that you can advocate for yourself to get the care that you need. And then seeking out a diverse dental team. So this can be a little touchy subject for people who may not look like us, because they may feel like, hey, you should just go to anyone. But we know that at times we feel more comfortable when we see someone who looks like us, possibly because we know that they may know what we're going through. They can identify with our cultural history, possibly. And so it's important to have a diverse dental team at least, or a healthcare team working at your facility, because they may understand or be able to communicate with you more concerning your treatment. Everyone's treatment may be the same, specified, but they may know why you're afraid. Because of the history of the country. Or even when I speak to my Black therapist, I can use certain movie quotes and she gets what I'm saying and everything. So just having that common factor, that denominator, really can be helpful. So one thing that I do in my career is I'm a career counselor for young ones, and I do try to increase their awareness for going into the dental field, because we do need representation. We need people who look like us. And then basically, to improve our oral health, we have to make sure that we are doing our part. So making sure that we're brushing twice a day, 3 times a day, if so, but 2 times at least, morning and night. Making sure that we're cleaning in between our teeth. So a lot of people, we have nagged people to death about flossing, and not everyone can floss or wants to floss. So there's other tools out there, like a water pick, a water flosser. Find something that works for you. Use an antimicrobial mouthwash if you can. I work for Arm & Hammer, so we have their breath. I think that's the best and everything. And it does help prevent bad breath. Some of them prevent bad breath for 12 hours. However, you want to get to the root of the problem. So if you have bad breath for a while, you want to see if something's going on. You need to go to your doctor, see if something's going on that can be fixed. You don't want to just cover up stuff. Avoid using tobacco products, and then visit your dentist/dental hygienist, because we're better. I do love dentists though. Visit us regularly, because we really advocate for our patients. Dentists are awesome too, but we advocate for our patients. And there's other tools that you can use. Like I said, I do work for BioGaia. So BioGaia is oral probiotics. So it's an extra adjunct to what you can add into your routine. I actually gave it to the lady at Sephora. I had some in my purse. I gave her some samples and told her to talk to her doctor about it. But that's something that we think of probiotics for our gut. So we also can add in good bacteria to kind of eat that bad bacteria that's in our mouth. So it's going to lessen the inflammatory diseases in our mouth and cavities. And then, like I said, I work for Arm & Hammer as well. So I really do like our toothpaste, because it does help to neutralize the bad bacteria in the mouth. And it does help to lessen cavity activity. So we have studies about that. So if you work for a medical or dental facility, those are my codes right there. I can do a free lunch and learn with you guys for your office, or you can pass that information along if you know of a clinic that could use my services, so that we can help out the community. And that's it for my presentation for the most part, just knowing that there are things that we can do. We want to advocate for ourselves. So we want to do what we can at home, but we also want to make sure that we're seeing the professionals. I love DIY like the next person, but we have to make sure we are getting ourselves checked out, because we do have a higher prevalence of everything, it seems like. So making sure that we take care of ourselves allows us, especially as women, to continue to take care of our families.
Good job, Kari. I knew you were going to knock it out the park.
What I do.
That's what we do. All right. So I will speak a little bit about dental trauma. And basically going along with what Kari said, we can cause dental trauma in our own mouth by not using the correct products or the correct tools. So I wanted to kind of go over that. And we can also cause trauma when we're taking our little ones to the dentist. I actually posted a video on Instagram about, please do us a favor, because I work in a children's hospital. I'm in Boston, Massachusetts, and I work in pediatrics. So they're always nervous, they're always crying. So I have to do everything to allay their fears. So basically, I say to parents, please stop instilling dental trauma in these kids. They've never been to the dentist. You keep telling them, if you don't behave, I'm going to take you to the dentist and you're going to get a big needle. I cannot tell you how that just drives me insane, but that really is reiterated generation after generation. As Kari mentioned, a lot of us have not had access to care. A lot of us may have Caribbean backgrounds or just from other countries where it just was not an issue. You only went to the dentist if a tooth hurt. And if that tooth hurt, you either didn't have the money to repair it or you let it go so long, there were no options except to take the tooth out. Well, now we're learning about prevention, right? So what I do is, since I'm in pediatrics, I use this little brochure. You can't really see it that much, but basically it's a booklet. And I show the parents, because we have a lot of Spanish speakers, a lot of Arabic speakers, like all different nationalities. But regardless of the language, pictures speak 1,000 words. So what you want to do is when you are out shopping, because I go to Target, I go to CVS, and guess where I spend the majority of my time? In the dental aisle. And I'm looking at products and I'm like, why do they sell medium and hard toothbrushes? If you're looking for toothbrushes, please look on this packet. I don't know if you can see it. It will say soft, medium, or hard. You should never be using medium or hard. Never. Electric brushes are always soft. You can even get extra soft. If you use an electric brush, you're letting the brush do the work. Please do not get in there and start aggressively brushing, because then you'll really be in the chair with me, Kari, and Dr. Gordon to see a periodontist or a gum specialist. So you want to look for the ADA seal, which is going to always be on each product that you buy that we recommend, okay? I have a sample because I'm in the clinic. It's Colgate Total. A lot of people ask, should I use charcoal? Should I use Sensodyne? Should I use whitening? Like what toothpaste? Because there's so many. The basic ingredients are tartar or plaque control, fluoride, and if you want, you can look for something that says xylitol, which will help to minimize decay as well. But the biggest thing is to keep it simple. If you look for the symbol ADA on mouthwashes, rinses, if you decide to do whitening products, you're pretty much safe with that. I always recommend flossing first, but my colleague may say it doesn't matter. She likes to brush first and then floss. It's a personal thing. There's no research that supports one or the other if it's first or second. People ask all the time about these floss picks. I see them on the ground all the time, so I know people are flossing. But you ask yourself, should I floss a little kid's teeth? At what age should a kid go to the dentist? We recommend as soon as the child has a tooth, get them in that chair because it will allay dental trauma. With these floss picks, I'm not a big fan of them. They do come in handy, but if you're using a floss pick, please do not saw it back and forth. You want to go up and down on the side of the teeth. You wipe it or rinse it and go to the next tooth. You could use it for the morning or at nighttime. I prefer to floss at night. It's better to floss at night before going and doing it the next morning, because that will help you to avoid having that dragging, right? People wonder, why does my breath smell so bad in the morning? And it's usually because bacteria has sat in the mouth all night long. It's dark in the mouth is dry. Be careful of snoring. Okay, that's another thing that we assess for in the dental office. So I just want to say, when you go to a medical field or medical facility, we are always looking at the MD or the doctor, right? And then if we don't trust the doctor, we ask the nurse, right? And then who might take you back and do your blood pressure in a medical facility? A CNA or maybe an LPN, a licensed practical nurse, right? Well, let me give you a similarity in the dental breakdown. An MD is to a dentist as a nurse is to a dental hygienist. Okay? An LPN is to a dental assistant. Okay? So dentist and MD, nurse and dental hygienist, dental assistant, and LPN. I was applying for an application to make a purchase, and they have dentist, they have nurse, they have attorney, nothing that says dental hygienist. And I get quite offended because we have to take a lot of exams. You can have an associate's degree, you can have a bachelor's degree, you can have a master's degree in dental hygiene, but we don't get the flex that we need, that we deserve, because I'm pretty sure we took all four of us, or all three of us took 4 exams to pass our dental hygiene boards. Okay, so when you go into an office, there are little things that we're going to be screening for, as Kari mentioned. Also, your steps, flossing and brushing. Annual visits are not enough. Sometimes we need to see you 2 times a year, and a lot of times we need to see people 3 and 4 times a year, because we're all about prevention. Now, I did talk about dental trauma, and this is why I stress, do not use a medium brush or hard brush, because you can cause dental trauma inadvertently. If you're flossing your teeth and gums, if you saw that floss back and forth, you will cause dental trauma. If you're scrubbing too hard on the tongue, sometimes people have what's called geographic tongue. It looks patchy, kind of like eczema on the inside of the mouth, but sometimes that could be from stress, it could be from mouth allergies, it could be from products and different, or I should say ingredients in different products that maybe just don't work for you. So those are things that you want to look for in a roundabout way as far as avoiding dental trauma. And to close my session out, the reason I became a dental hygienist and not a dentist, I remember as a kid, me and my brother hated going to the dentist or dental hygienist. She was the roughest, meanest. Like, I was like, I'm going to dental hygiene school because I can't have people like this in a profession that don't like people, right? So haven't you seen people in your profession, whatever industry you're in, they just hate their job and they're just going through the motions? Well, if you find a hygienist that is doing that, find another hygienist. You might ask, how do I choose a hygienist? I always use Google reviews because I've worked in different states and I have to refer people. Here in Boston, we have 3 dental schools. A lot of schools don't, a lot of states don't have that. So if you can find a dental school, as Kari mentioned, we always need patients. Dental hygiene school, always need patients. And the rates and the service is going to be monitored and checked by those professors who are screening those dental and dental hygiene students. So if dental insurance, if you can't afford it, if your job doesn't offer it, you use Google reviews. You can tag Kari on Instagram. You can follow me. I'm the busy RDH. You can follow Dr. Gordon, who is going to come and bring it on in, just to see how the whole body relates to itself. And also, when we go to the hair salon, right? Isn't that where we do a lot of networking? Girl, did you know Target had a sale? Did you know DSW had a sale? You could do the same thing in your network if you're new to an area. You know, do you have a good dentist that you go to? I was on a phone call last night with a lady I never met. She was referred to me because she had a bad dental experience, and it could be that that particular dentist is going to be sued for malpractice. So before you go through that trauma, ask your colleagues, ask your family, reach out to people who look like you. Look at their following, look at their Google reviews, watch their videos. And this way, you know, it's about prevention. Not all the time do you have to wear dentures or fake teeth. There's so many options that are now affordable. Even implants, not everybody's a candidate, but you can see if you are a candidate. Whitening, should you do whitening? Those are things you could talk about with your dental hygienist. So we understand our scope of practice, we stay in our lane, but at the same time, we do advocate for prevention. I hope I covered that well as far as avoiding dental trauma and also talking to your little ones and even our elders who maybe have lost their teeth. My grandmother's 97. She has every single tooth in her head. She refuses to use a soft toothbrush, though. I can't get her to use soft. But those are the things that we want to see because it does relate to our overall health. So Thank you so much, Queen, for allowing us to be here. And next, I would like to turn the screen over to my friend, Dr. Karen Ann Gordon. I will say that I have been on her table, okay? And she is the truth. If you can get down to Florida, she is the truth. Take it away, Dr. Gordon.
Hello, good night, everyone. Um, these ladies have set me up very nicely. So I'm just gonna segue into some very serious topics. Let me just bring up my info. I'm gonna share my screen real quick. Okay. Just give me one moment. I just want to show you. Okay. I'm just gonna jump into my presentation here. So this is my my background. I am a dental hygienist. I've been a dental hygienist since 2005. Strange but true. That's a very long time. That's like, I was like shocked, like, oh my God, it's like so long. But I've been a dental hygienist since then, and I practice dental hygiene still. There became a point in my life that I needed a change, and one of the changes that I made was to go into chiropractic. So I'm a chiropractic physician. Excuse me. I'm also a writer, speaker, and educator. Right now, I teach at a chiropractic school full time. I started out as I started an organization with a group of friends called SWIFT. It's about empowering women, pretty much like Queen. And the whole purpose was that I realized that when it came to healthcare, women don't really get the needed support that they need. It's actually pretty difficult. And especially when you're lovely and melanated as myself. So we just really wanted to support other people that want to pursue healthcare careers. So there's my information. You can scan the QR code and then you'll be able to find all of my links. If you're looking for me, I'm at the TMJ Therapist on Instagram. And from there, you can find all of my other background information. But tonight, I want to talk to you about something that we really don't talk about as women. I talk a lot about the TMJ, but today we're going to talk about the body overall. So let me just pull up this slide and we're just going to chat, have a little discussion about it. And, I love that Kari talked about, how we can use oral hygiene to take care of the rest of our body. And Steff talked about how, we shouldn't have dental fear and trauma when it comes to going to the dentist. And, we live in a time now that we have to be able to recognize that there is a connection between the mouth and everything else in our body. It's actually pretty crazy when you start to think about it. Now, in the African American community, as you look on my screen right here, we are affected by all of these things for one reason or the other. So firstly, I really want to talk about diabetes first, because diabetes is one of the things that affect our community, affect brown and Black community. And we find that there is a direct relationship between your oral health and your risk for diabetes. And the thing is, most people don't realize that, okay, oh my God, I didn't really take care of my mouth. Now my teeth are falling out. And if you really do the research, you realize that they also end up having things like diabetes. And anytime you have diabetes, we can link that to cardiovascular disease. So people also have high risk for stroke, they'll have high blood pressure. Those things work hand in hand. And it's kind of like the chicken or the egg. Which one came first? People really don't know. They can't really tell. But what we do know is that the same bacteria that lives in the mouth actually causes diabetes and influences insulin resistance, which is a part of diabetes, and also influences cardiovascular disease. So I wanted to bring that up tonight because women typically do not realize that they have a heart problem. We are the first to really feel the effects. We don't even have the same, we don't express the reaction to like a heart attack the same way a man does. You know, we're women. So because we're women, most of the time we'll just go through it, feel the pain and keep it moving. That's what we do. You know, I got work tomorrow. I have got the kids to feed. You know, I have things to do. That's what we do. So let me just talk about some of the things that we'd recognize if you were to have diabetes, for example. A fruity odor in your breath. You might be getting hungry a little bit more frequently, or very, very thirsty, urinating a lot. Those are some of the things that we see. In the mouth, what we will see is fat gums, bleeding. It might be red, bloody. You know, you're flossing, you're cleaning your teeth, but it doesn't seem to be going away. And that's because your system has been compromised. And then let's talk about heart disease. It will come upon you very slowly. All of a sudden, your blood pressure starts going up. You might see that you start to bruise easily on your skin in the mouth. And then you might have difficulty even doing tasks. That's a little giveaway right there. You know, you used to always be able to run up the steps, no problem, play with your kids, no problem. Now you're becoming breathless. You're becoming tired. And that's because your body is not able to pump all the blood and oxygen that it needs. And then I say this to say that a simple thing as being screened in the dental office is going to help you to kind of start thinking, this might be the beginning of a disease. If you go to the dental office, every dental office should be checking your blood pressure. Back in the day, I'll be honest, I'm like, it's a dentist. Why do I even need to do that? But now that I've become more educated about the needs in our community, it's important that we are screened regularly. Okay. So those are the first two things I wanted to address because this is a widespread in our community. And then the next thing that is becoming more apparent is Alzheimer's disease. Now, this is complex. I'm not going to go into too much detail, but again, the bacteria that we find in the mouth also affects our ability to function from a cognitive perspective. That means doing our everyday tasks, and we end up with Alzheimer's. Okay, so again, keeping your oral hygiene under control. Now, if you're childbearing age, we have different adverse outcomes. You could end up with low pregnancy, birth weight, weight, and you can have things that pop up in your mouth. For example, you'll have like what we call a pyrogenic granuloma. So it's a big fat swelling that's red, it's inflamed, and you know you'll have bleeding, and that's because your hormones are really dictating how your body is responding to this new thing that's happening. Okay, now I'm gonna dive a little bit deeper into hormones and women's health. Now, as we go through the stages of our life, our hormones do change, and so does the effect on our oral systemic condition. Our mouth is just going to keep on changing. Now, when we're children, we don't have our periods yet. We haven't started our menses, and you know it's pretty healthy in the mouth because a child, as Steff can concur and Kari, a child does not have disease in their mouth. Their mouth is perfect, but we introduce disease into the mouth, and then that becomes a problem. Now, when you start having your menses, what happens is this hormonal change that starts to affect you in a cyclical way. So there are different times of the month that your mouth will be more sensitive, you'll have more bleeding, you know, all of a sudden your teeth are sensitive and you just don't understand why. And if you really pay attention, it has to do with the cycle of the hormones. Now, in adolescence, as we're growing and getting older, we're less likely to develop periodontal disease. However, if we don't have good oral hygiene, that can persist and become a bigger problem. Now, let's talk about as we get older. Now we're into childbearing age. We just talked about pregnancy outcomes, what can happen. Let's take a little bit further. Now we're getting into our 40s. Okay, now this is the new big evil thing that even myself is facing, perimenopause. So when we get into perimenopause, and I don't even know why people don't talk about it. It's like a hush-hush secret. But perimenopause is a new change in your whole hormonal chemistry and your whole biochemistry. What starts happening is all of a sudden you have bad breath. All of a sudden you have bleeding gums and you're taking care of it. You don't understand why. Your mouth is drier, your teeth feel more achy, your gums might swell up. And these are related to the fact that now your hormones are changing. You're becoming more acidic. And as you become more acidic, you become more prone to decay. So your body's like fighting you and you're trying to do everything, right? So we have to counteract those interactions. And then as we move from this stage into menopause, again, we're hit with a different set or a different way that our hormones are now beginning to affect us. Now we pretty much have nothing going on, not much hormones. We've gone through the stage now where we're even more at risk for periodontal disease. So as women, we have to be on top of our oral hygiene because we go through this cyclical change throughout our lifespan. Now, I also want to segue into oral cancer. As we're going through all these changes hormonally, we're also at risk for increased risk for oral cancer, cervical cancer, colorectal cancer, gastrointestinal diseases. All of these things increase with age. Now, guys, I'm not saying that we're going to break and fall apart, right? Because it sounds like I'm sending you to doomland, right? But I'm just making you aware because sometimes we don't realize that something as simple as our mouth is affecting everything else. It's literally is the gateway to your whole health, right? And what we have to realize is if we're not taking care of what's in our mouth, and then we start to ingest it, then now it's into our GI tract. It's into our gastrointestinal system. The same bacteria that's causing the problem in your mouth because you're not brushing and flossing regularly is now causing a problem in your GI tract. Now it's causing a problem in your colon. It's just causing an endless problem. A little known fact that most people don't know, your mouth to your anus is one singular tube. It doesn't cut off, it doesn't stop, it's just a continuous tube, and each part has different functions. So we have to safeguard the first part that things enter into our body, and that is the mouth, so that we don't have a problem when they leave our body, okay? Now, as women, another thing that we have to be very aware of is the risk for breast cancer. Breast cancer, yes, is in fact related to our oral hygiene in a very roundabout way. It's related in the way that if we don't have good oral hygiene, we become immunocompromised, and that increases our risk for cancer, especially if you have the cancer gene. And I do suggest that anyone over the age of 40 and up should get themselves screened for breast cancer. And also they should be monitoring even their health history, their family. A little known fact is that if you have had someone in your family, and I'm sure every single person on this call knows at least one person that has been affected by breast cancer. I'm not talking about the other cancers. I'm talking specifically breast cancer. I mean, here, I know at least 2-3 people in my family, outside my family that has been affected. In fact, I have an aunt, I'm sorry to say this, but she's actually right now in a induced coma because of dying from breast cancer. And it's serious. So I want women everywhere to be aware of it because it's really affecting our community. I think it's kind of downplayed. We really have to do the research. There's no reason why people in our community should not be successful at recovering from breast cancer like the non-Hispanic or Black and brown people are, okay? And then next thing I want to talk about is respiratory infection. Now, we just went through 3 whole years of COVID. It wasn't by, I wouldn't say it wasn't by surprise, or it wasn't, it's just, let me rethink my thoughts. COVID showed us that oral systemic health is very important. Why? The same bacteria that's living in the mouth, if it's overgrows, it can go right into that respiratory tract. Here on my my screen, you can see here the same bacteria that we find in the mouth, this particular one that's in purple. If you look on the screen, Performanis gingivalis, I always say it wrong, but P. gingivalis, you can see it's in every single system. It's a tricky one. This is coming from the mouth. The word gingivalis means it's from the mouth. They can find it in the respiratory system, and when it gets a chance to overgrow in the respiratory system, it makes us immunocompromised. Okay, so again, COVID, we found that in COVID, people that had poor oral hygiene were more susceptible to and were affected even worse by COVID virus. So again, I'm going to stress we need to make sure that we take into account our oral hygiene. So how can we affect all of this? Kari and Steff gave us some good tips and advice, making sure you see your dental hygiene professional regularly, because we are, to be honest, we're the people that see you all the time. It's not the dentist. The dentist see you when something's wrong. We see you literally all the time, sometimes 3-4 months, every 6 months. We're the people that you know. So if you find that there's something that's not quite right in the mouth, I implore you, go in to see your oral hygiene professional or your dentist so that they can address it. 9 times out of 10, we know what's going on. And then I implore you also to start taking care of your bodies. We have been so good at taking care of everyone else, and we're not taking care of ourselves. So part of taking care of yourself, it involves a multimodal approach. I'm just going to bring it up here. I believe in working with a team. So this is a protocol that I strongly believe in, working with your dental team, a manual practitioner like myself, because we deal with pain all the time, senior medical professional, working if you have anything that is affecting how you're sleeping, more than likely you might have sleep apnea, or you might have some kind of sleep disordered breathing. You want to see that particular person. Getting support from your community is very important. I find that when we don't have community support, it really limits what we can do for ourselves and do for others. And most importantly, because this is a big topic, we need to make sure we have a mental health team to work with. Your mental health affects everything that we do. And if we're not able to express what's going on, then we won't be able to fix the problem. I remember a patient that came in and she was talking to me about the whole COVID thing. And during COVID, she lost some family members. It was very sad. And she was not able to take care of herself. She was always on top of her oral hygiene. And when she came in, her gums were a hot mess and she was just distraught. And she said, you know, I really didn't take care of myself. And I was really depressed during this time. And I expressed to her, because no one ever mentioned it, maybe you should speak to someone. You know, so sometimes the person might not realize that they need that additional help, but being able to make sure that you have a team working with you healthcare wise will help you to recognize when you do have problems. And that is my presentation. Again, if you have any questions about anything I talked about, you can always snap a picture of my my link tree here from a QR code, and then I'll be happy to answer your questions if you hit me up on IG. I'm pretty much always on IG, and thank you so much for having me express myself.
Well, thank you three for sharing the knowledge you have and even your time, because I know you three are pretty busy. But we want to open the floor for about 10-15 minutes. If anyone has any questions, would you like to turn your audio on, unmute yourself and ask away while we have them? It's not often that we have the opportunity to speak to dentists or dental hygienists. Honestly, this is my first time even hearing the term, so I'm going to use it as much as possible this evening. Does anyone at all have a question they'd like to ask? Please unmute yourself.
Just so you know, I did drop in the chat, it's called the lovelandfoundation.org. And so that actually is a organization that can help people who do need therapy. They
wow.
do provide free therapy for people of color. So they provide 12 vouchers if you get accepted into that cohort. 12 vouchers to see a therapist. They can help you get a therapist. So it's a great organization. So I would encourage anyone to share that information, click on it, fill out the Google form and everything like that. Because as Karen closed out, a lot of times the mental health aspect is a part of the oral health and the systemic health.
Thank you for the information.
I have a
Definitely.
question for Ms. Kari. In regards to the BioGaia, am I saying it right? BioGaia and the TheraBreath. Is there also a kids line too? Because I have smaller children, or is this only for adults?
No, let me put that slide up. I think I still have it up there right now. So they do have, am I showing it? Yeah, they do have kids. So my son is almost 3. And so they have drops for children who are under the age of 3. You would use the drops, and like if you had an infant, you could put the drops onto a clean finger and massage it into the baby's gums. It does help with teething as well as thrush or oral candida. So yes, they have the lozenges, which can be used at an older age, 3 and up, and then they have the drops. And then for the TheraBreath, they do have rinse for kids. So it comes in watermelon flavor, strawberry, and grape. They taste really good. I put it on. The kids aren't really supposed to rinse with it until like they're 5 or 6 because they have to be able to spit out. So for my kid, because he does get stinky breath at times, I put it on his toothbrush and a little bit on his toothbrush, and then I put his toothpaste on there and brush his teeth because he has to take out butyrol and, the bacteria and everything. So yes, they do have different options.
Okay, thank you.
Welcome.
Any other questions?
And just so you know, for BioGaia, sorry, you
That's
can
okay.
you can purchase that on iHerb.com, Walmart, and Amazon. They do not sell that in the stores. For the TheraBreath, you can purchase in the stores, but you may not always see it for the kids. You will have to just kind of Google and see what the kid versions are. They don't always have everything.
Okay.
Does anyone else have any questions?
Don't be
Okay.
shy.
I can't see anyone. Hold on. You want to stop sharing the screen? I can't see
Yeah.
anyone. Oh, there you all are. Does anyone else have any questions? So I'm going to wrap up this evening by saying I am fearful of turning 40. She spoke up. At age 40, a lot of things start to change. And right away, I started rolling my tongue in my mouth and everything. She said, you start to feel sensitive and everything. So I'm 37 years old and excited about 37 and approaching 40. But you three gave insight on many things that I wasn't aware of before. So speaking of, COVID kind of was like, duh, right? It affects the mouth first and then it travels throughout the body. And then when you said tube from your mouth to your anus, I was like, in a weird way, the way I visualize it is like, oh wow, yes, that is true. Another point that was made that I appreciate tonight was looking for the ADA seal and also the soft toothbrush. I always assume the harder the better. So I would go for the hardest toothbrush, and if something were soft, especially when I go to the hotel, I'm like, this is weak. Toss it. I go right to the nearest Walmart, and I want the hardest toothbrush there is. And if I can't find the hardest toothbrush, of course, the electrical one is amazing because it feels like it's working. I'm the girl that, even when I try to be natural before I cut my hair, and they would say, you want to co-wash your hair. And I'm like, well, where are the suds? So it's the same thing. It's like, I need to see soap and I need to feel the pressure of the toothbrush. Another thing that was pretty amazing was understanding the difference. It's better to visit the dental hygienist than the dentist. I never even knew that were an option. And then 2, I heard it online and didn't really understand it, but clearly, but to have something that you eat to kill the bad bacteria because it affects your mouth. So I need more information on that. I'm gonna do research. You also spoke of volume versus nitrous in medicine, that you can request that. Still don't really know what that means, but I'm gonna do research. So you gave me homework. And then last was the water floss. Never heard of it. And we probably used it on my teeth when going to the dentist. But I just wanted to share the notes that I've taken that, really got me so excited. And I feel like I'm going to schedule an appointment tomorrow just so I can get in front of a dentist and say, no, we're not doing that. And you did not check my pressure. What is wrong with you? Check my pressure.
No, I will say to you too, Queen. I went, not tell my, I've said in my chat that I'm one of those people, like you said earlier, Ms. Kari. I haven't been back to the dentist because the bill that they gave me when I went, it was like, okay, you need 2 root canals. We got to do this. I'm like $3,000. Like, wait. So I haven't been back, but no, my dentist never took my blood. That I remember when I go into the dentist, take my blood pressure. So that was new.
Yes, yes. So we want to thank you all for this information because it's very giving insight. We're now educated and informed. And what do women do? We all share that information with others, right?
We got a network.
Also, exactly. And I can also appreciate you saying that you want to work with someone that looks like you. So in age, in race, gender, ethnicity, whatever it may be, because they will understand you better. So if you are Portuguese, Spanish, African, American, it doesn't matter. You would connect with them more. So as Steff stated, you go online, you do your research, you look at the reviews, and you try to connect with someone that's most suitable for you. Don't just go with whoever's in the office, and look for the dental hygienist because they're probably going to care for you better, right, Kari?
Yeah.
I did, Queen. Can I add something?
Yes.
Someone put in the chat that they're going to buy toothbrushes tomorrow. So what is a good guide? The brush that I'm holding, it says soft. It's a Colgate. It's a zigzag, right? But the head is too big for my little kiddos.
Mhm.
Okay, it's too big. So some of us, even though we're adults, we don't have big mouths.
Right.
So if you look at the head, sometimes you can look at the pad of your index finger. You know what I mean? So make sure that the head fits your mouth, because otherwise you'll be traumatizing your mouth.
Oh,
Everybody's
Lord.
heard of gum recession. So
Yeah.
sometimes that's what I'm saying. We can cause trauma inadvertently to our own mouth just by not using the right technique. You know?
Yep.
Mm.
So even
I
when
can,
you floss, there's a way that your hygienist, if you say, can you show me how to floss? We would be elated to show you how to floss.
Yeah, don't saw. That was another thing.
Yeah.
I saw. I'm a
and I
saw.
can, let me just add real quick to what Steff said. There are lots of toothbrushes out there. Okay. I mean, you could go nuts. Right now, the latest craze is a bamboo toothbrush with natural bristles. Honestly speaking, I literally do not care. From a holistic alternative healthcare perspective, all I care about is that you're cleaning the mouth. Now, how you clean the mouth? Definitely, I'm an advocate for an electric toothbrush. I find that sometimes they're a little bit too expensive. There is one that I recommend that you can find on Amazon. It's like $25. It depends on what your budget is. It's Philips One Sonicare. Love that brush. The brush head is small. All you have to do is angle it towards your gum line, and bam, there you go. Another thing too, a rule of thumb that we teach our patients when they're brushing: if you brush, come on now, I know some of you do it. If you brush and your toothbrush looks like this, it's too hard. Okay? I used to tell my patients, if you use your toothbrush, if you use a brand new toothbrush and you run it, a hard toothbrush, and run it on the back of your hand, don't it scratch you? Exactly.
Right.
So your gums are even more sensitive than the back of your hand. Your gums are so sensitive, you could feel a hair that's stuck in between your teeth. Your teeth are that sensitive. Do you know how fine a hair is? So if you're going to be using a hard toothbrush or anything beyond a soft, all you're doing is creating these cut wears into the gum and the tissue. And then all of a sudden, you got periodontal disease, your tooth be falling out your head, I don't understand why this is happening to you. So, you know, less is more. You don't want to see your toothbrushes splay like that. They need to be standing upright. Another thing too that I need to add when it comes to oral systemic health, if you've had your toothbrush for more than 6 months, let me just give it a side eye because that's gross. Okay, you should be changing your toothbrush. I'm weird. I'm paranoid. I change my toothbrush at least maybe every 3 to 4, 6 weeks. I'm just weird. Okay, and if you got sick, if you were sick, do not use that same brush head because the bacteria is still living in that brush head. Please throw it out, throw that old brush and get a new one. Okay.
I'm
And if you,
interject.
huh?
So I'm gonna interject because if you don't have the finances to change the
Mhm.
toothbrush as much as Karen's saying, there are other things out there. So there are UV sanitizers. There's things that you can purchase that you can put the brush head, so the electric toothbrush head in there, or you could put your toothbrush thing and it's gonna sanitize it overnight.
UV
Yep.
sanitizers for your
oh,
toothbrush?
Yep.
Especially,
Yes.
yeah, you could do it if it have electric. It might come in that system, or you can buy it if you have a manual brush. The other thing, when you're buying toothpaste, you're gonna look for something because everybody wants to be a little whiter. I'm not saying we discourage whitening paste, but just know that whitening toothpaste typically do not have a tartar or plaque control ingredient in them, unless it says, Colgate Total,
Mhm.
or Tom's of Maine. Even little kids up to a certain age, I mean, they shouldn't be using kitty toothpaste because they can get tartar too. I scale these little teeth. I had a 6-year-old and I'm like, what is this? I had to pull out my scalers on the kid. So that rough stuff that we get in the back from the salivary gland sitting there, like Kari and Dr. Gordon mentioned, if the mouth is dry, if you're doing a lot of yogurt, if you're doing seltzer waters, you know what I'm saying? If you're doing your, what's another one? People think that ginger ale is safe because it's a lighter soda or
That's right.
Sprite, or they like these fizzy drinks, okay? I have my tea, but at the same time, you can use a metal straw so that the stain doesn't, affect your teeth. But the biggest thing is tartar control and fluoride is what you're looking for in your ingredients. Now, if you want to use Sensodyne, usually Sensodyne will have a desensitizing agent, but it usually doesn't have tartar control. And that's what we go after when you sit in the chair. But if
And
you can get that tartar control, literally, then we don't have to scale and scrape as much. The other thing is your cheeks, they do move, you know? So when you're brushing, I always tell patients, hold their toothbrush like a glass of wine. You don't have to hold it like a hammer when you're brushing. Hold it like a glass of wine, let that brush hit the teeth and the gum, and you're just massage. Yep, just like Dr. Gordon has. So I have that pinky off the handle. You line that brush up where the teeth and the gum meet. You do a little massage, 1, 2, 3, 4, 5, and you go around the fronts, the backs, the tops, then the bottom teeth, the same thing, the outside, the inside, and the back. You can get a tongue scraper. Has anybody had those little nasty, stinky balls in the back of their throat that ever fall down? You ever had those? They're called tonsil stones. Now, you want to talk about something funky and nasty. That right there is a way to let you know that either you're having too much dairy, there's something going on in the system where it gets trapped. So I'm not a big fan of Listerine. Some people like it. I like that product, Tom's of Maine, because it has xylitol, essential oils. It doesn't peel. Even though Listerine, I'm not bashing them, but even though they say there's no alcohol, I can't use it for whatever reason. And some of the older brands or the older, I guess, combinations of Listerine, we had to keep it away when I worked in a periodontist office because people have substance abuse. They're alcoholics. We can't give them alcohol. We can't give them Listerine. So what does that tell you? So just being more informed about what's on the market. If you follow our pages, you will see that there's a lot of information that you can really do, even if you can't get to the dentist as you would like to. You can do the preventative things, the oral cancer screenings, filling your lymph nodes. There's a way to, like they spoke about. so that we can kind of, keep ourselves educated. That's why we're always doing continuing education amongst ourselves. We keep our license active, so that we can continue learning. And
So
then
all of
share that
the,
knowledge.
yeah, so all of their accounts I put in the chat room as well. Feel free to share. To follow. Kari, you wanted to say something?
Yeah, I know we're closing out, but I just want to mention that it's so important that you find we have time today. We made time, so we have time to educate. But when we see patients, we don't always have as much time. We're not always
Right.
giving as much time.
Right.
So when you do go to an office or before you go there, ask how long your visit is going to be.
Mhm.
And ideally, you want a longer visit. So although you may want a short visit so you can get in and out, you do not want a quickie visit when it comes to your health, because that means they are missing things.
Mhm.
So especially if you are having financial issues and you have work that needs to be done, if you can try to go to like a public health clinic or to a school, because generally they are going to have more time to give you. Sometimes schools is going to take hours, it's going to take multiple visits, but they have instructors that are watching every single step. So at times you're getting the best care and it's the most sterile ever. So don't just try to go to an office that it only took 30 minutes for your visit or your cleaning.
Right.
That may feel good because you're in and out, but that means they missed on certain steps. So that's just like when we get our hair done or our nails done and they in and out, we just like, I didn't really, did she do the massage or did I get, the same thing, but this is your health. So you don't
Right.
want me to miss out on the oral cancer screening, or, they didn't check your gums or they didn't do any of this, because then that can cause issues. So that was all I had to say.
Thank
I
you
just
so
want to-
much.
One more thing before you guys go. I just put in the chat. I'm obsessed with this app. As a chiropractor, I'm always looking for healthy alternatives to make sure that we're living a healthy lifestyle, because there's so many toxins in the world that affects us. It's called Yuka. Girl, I go everywhere scanning this thing. I scan my shampoo, I scan everything. And what Yuka does, it helps you to look at the ingredients that are in the food, the foods that we eat, the chemicals that we use in our hair and our body, and it will show you if there are any forever chemicals. Okay, we live in a world right now where there are lots of forever chemicals, and even though we try to reduce things, those things come back to haunt us, and then it creates a problem for us. And to add my last bit that I wanted to add with regards to oral hygiene, and this is not really something that most people talk about. When it comes to your brushes, guys, please do not store your brushes in a closed container. Make sure you leave your brush out and open so that it can dry and it does not gather additional bacteria. If you didn't know, I'm semi-germaphobe, so bacteria is one of the ways that things happen to our body, and I just want to make sure you guys were aware of that. And definitely, please, guys, use the Yuka app. It really does give us some information about the stuff that we're using, and anything to do that can help us to be better with our health. I'm all about it. And if you need more information about that, again, hit me up. No problem. Thank you so much.
You're welcome.
Thank you,
So like
lady.
Dr. Karen said, make sure you check the chemicals. I wrote that link down. I will check every item from here on out. And like Steff said, brush your teeth. So when we're done with this call, everyone should be in a bathroom and do it at least 2 to 3 times a day. Like Dr. Karen, we want to do it 2 to 3 times. And like Kari said, it's the window to your body. And now I see my mouth differently. Before, I wanted to go in and just make sure it was fresh. That's all I care about. I just want it to smell good. I smell. I don't want anything in between my teeth. I don't want it to turn yellow. I don't want to lose any teeth. But now I see my mouth. I have more respect for my mouth because now I understand it's like the tube that never ends. Whoever said that, from the mouth to the anus.
Dr. Gordon, this is a lot of fun, Queen.
Yeah. I thank you so much for the wealth of knowledge. I'm going to share this with my family, and we're going to get to it. We're going to change our brushes because we were all sick this weekend. And yes, I'm thankful and appreciative. And I hope to have this session again soon. I'm sure I'm speaking for everyone. We thank you for your time. We thank you for the knowledge you shared and empowering us as women to just be, the best and the healthiest version of ourselves.
The feeling's mutual. Thanks, Kari. Thanks,
having us.
Dr. Gordon.
Thank you.
Thank you. Thank you,
Have a
guys.
good night, everyone.
Good night.
Bye.
Bye.
Bye.